thank you for your presence here today, for your continued commitment and support to the Defeat NCD partnership. This year, our session is focused on action, on commitments realized, on guidance applied, on words being translated into action. We have a rich program for today, starting with a keynote address by one of the earliest supporters and thought leaders who has been guiding and supporting the Defeat NCD partnership since its inception, really, and making sure that its strategy and focus is on practical action complementary to the norms and standards of the World Health Organization. Ladies and gentlemen, Dr. Tedros.
The Sustainable Development Goals set a target of reducing premature deaths from NCDs by 1/3 by 2030. But on current trends, we will not reach that target. That's why we have called this session From Words to Action. It's time to step up. Far too many people around the world lack access to these life-saving medicines and interventions, especially in the lowest income countries. Today, we're discussing several efforts to address these severe inequities. One important contribution is the Defeat NCD Partnership's Essential Supplies and Distribution Facility, which aims to improve the availability and affordability of medicines, diagnostics, and devices. The partnership has also supported countries, including Rwanda and Gambia, to develop, fund, and implement national costed action plans, and together with WHO to support young researchers. Like any other area of health, research is essential if we are to make progress. That's why in WHO we have established a WHO Technical Advisory Group on NCDs innovation and research, which will focus on implementation research and on building capacity in research. Investing in the next generation of public health leaders and researchers in lower income countries will help close the knowledge to action gap and improve the uptake of proven NCD interventions. That's why WHO, the Defeat NCDs Partnership, and the Alliance of Health Policy and Systems Research have launched an NCD implementation research grant program for younger researchers from low and lower middle income countries. Today, we're pleased to present 8 finalists whose research effort will make a difference. Please join me in congratulating these young leaders. And before I close, I would like to thank Mukul, my friend, for his leadership.
What I would like to do now is to turn to Dr. Mansukh Mandaviya. Now, he is the Minister for Health and Family Welfare for the Government of India.
Namaste. Thank Juliet and fellow panelists for their contributions. Thank the Defeat NCD Partnership for organizing this session and for inviting India to be part of this panel and participating digitally. I personally related to the title of this session. I believe that in India, we have shown by example how words and commitments are translated in action and how strong leadership and partnerships can actually make that a reality. India has, over the last decade, transformed its presence on the global health scene and positioned itself to be the major producer of medicines globally, especially for non-communicable disease supplies, and medicines. This is a true example showing how building the right infrastructure, capacities, and structures in place helped us face a devastating situations during the COVID-19 pandemic, ramping up our production of supplies and vaccine nationally and responding to high COVID-19 morbidity and mortality rates, which were rapidly escalating to a national crisis. To ensure that our experience in India and that our huge production capacities are serving the global good, India can serve as the true pharmacy of the world. India is working closely with the Defeat NCD partnership. We have signed a partnership agreement that serves the various states in India to scale up their response to NCDs, but also bring India's expertise to other developing countries and ensure their continued access to quality assured, affordable NCD medicine and supplies through the essential NCD suppliers facility. Our national health policy envisages the attainment of the highest possible level of health and well-being for all through a preventive and promotive healthcare orientation in all developmental policies and universal access to good quality healthcare services. In India, National NCD program is being implemented for strengthening infrastructure, human resource development, diagnosis and management of NCDs. Facilities for tertiary care for NCDs are also being strengthened. In India, Ayushman Bharat is an attempt to move from sectoral and segmented approach of health services delivery to a comprehensive need-based healthcare service. Health and wellness centers are established where population level intervention has been implemented for 12 essential health packages including common NCDs. Under Pradhan Mantri Jan Arogya Yojana, we are providing health insurance coverage for secondary and tertiary care hospitalization to poor and vulnerable families. Our course, capacity building nationally and internationally, must be a priority to empower community and local authorities to avoid the devastating impact that epidemics, pandemics, and other emergencies can impose not only on the health system but further on the economic and social systems. We firmly believe that health promotion and prevention, including lifestyle modifications, are critical to addressing the challenge of increasing burden of NCDs. Awareness for prevention and control NCDs are well as healthy lifestyle being carried out in mission mode at all levels of health deliveries. We also recognize the need for involvement and active engagement of other non-health sectors in implementation of preventive intervention, where India has developed a national multi-sectoral action plan to guide multi-sectoral efforts involving other ministries, departments. I would like to highlight that in India, we are encourage young researchers to carry out research and act as catalysts for institutional change, which facilitates the development of and demand for locally generated research to address context specific problems and propose action oriented solutions. This in turn helps to effective policy and program implementation. For implementing our newly established National Vaccination Program for HPV vaccine in India, our drugs controller has given approval recently to Surveyvac, which is India's first HPV vaccine. Hopefully, it would be affordable and accessible to our prepubertal girls 9 to 14 age group. It is indeed a most appropriate time for actions to fight NCDs together and bring health and wellness. India assures that it is committed to the cause of prevention and control of NCDs.